My name is Darla Hansen. I work at MMC Medical Center in the Rehabilitation Department, and I am a physical therapist assistant, and I do specialize in wound care, as do several of the therapists that work here. I've worked at MMC for 27 years now. A lot of people don't realize that wound care is a part of physical therapy, and I guess in the way back how that got started was that physical therapy departments had whirlpools, and whirlpools used to be a large part of wound care. We still do use whirlpools occasionally for wound care, but there are many other options for wound care as well. Typically when you think of a wound, you think of falling down, scraping your knee, or something that a normal person would heal quickly. But there are many reasons why a wound becomes chronic and has a problem healing, and that's when we become involved with the patient's doctor. The person will come in, and there are several different things that we need to do to assess what type of treatment works for that wound. There are over 2,000 different wound dressings, and what you use can make all the difference in healing in, say, 2 weeks versus 2 years. So that's where we come in. Several of us have certifications in advanced debridement, which means getting rid of the dead tissue, and also just in knowing what the proper dressings are based on what the wound is. Some of the misconceptions that the public has on wounds is what to do when you have a sore of your own. Most of the time what we were taught by mom or grandma was to leave a wound open to air. Typically, a wound will heal faster and with less scarring if it's kept in a moist environment. So most of the time you want to do that. Typically, also a good thing for someone to do with a wound at home is to use an over-the-counter antibiotic to keep it moist. There are different ones available. Bactroban, bacitracin are some very good ones. You do have to watch. There are certain ones that cause more sensitivity and may actually make your wound worse. So if you notice in using an antibiotic cream at home that your wound appears to be worsening, or you're having any redness or irritation surrounding it, you probably are having a sensitivity to that. So keep that in mind. Telfa is something that sometimes people don't know what that actually is, but it is like the material that's on a Band-Aid. Most of the time that is a good thing because it will not allow that to stick to a wound. But when you're talking about a chronic wound or something that you're having trouble healing, one of the things that Telfa will do is hold the heat in, which sometimes can increase the germs that you have in a wound site. So you don't want to have that inability for the wound to breathe, and you also want to be sure that you have somewhere for the drainage to go. The best wound scenario is to keep it moist, but to control the drainage. A very common misconception is to use peroxide on a wound. Peroxide used in full strength is cytotoxic or kills the good parts of what's going on in your wound. I'm not going to say that we don't ever use it in wound care, but when we do, we use it very, very diluted, and it is only really kills spores for infection. Just because it bubbles doesn't necessarily mean that it is doing a great job for your wound. There are other options, and even just using for a typical wound at home, good old soap and water is a good cleanser for that. If you are wanting or having issues with an open area or a wound, whether it be something that's caused from diabetes or pressure or a circulation type of problem such as a vascular or arterial wound or a surgical wound, we are here to help you. And we don't necessarily have to do all of your dressing changes, but we can help to recommend what you can do at home to get that wound closed. Once you do have an open area and it is closed, that area will only be 80% as strong as it ever was. So that area is always susceptible for another open area. So prevention is the best cure in itself. See your doctor and come and see us at Rehab.